Let's go to Nelson Franco Jobim, who's a Brazilian journalist and lecturer in international relations. Nelson Franco, thank you so much for your time. Almost 9,000 people have died in your country in 1 week alone. More than 108,000 have become infected in the past 7 days. How much is the government to blame?
Well, President Bolsonaro has been considered by Ian Bremmer of the Eurasia Group the worst international leader in the fight against the pandemics, because he does not support these measures of isolation, and he sets a bad example. He mixed with the people. Yesterday, he mingled with lots of people in front of near the presidential palace, and he is fighting the governors and mayors that decided to adopt these measures of confinement. So the situation is bad, the health situation, the economic crisis, and we have also a political crisis.
What do you think of his argument that if there's an economic catastrophe, it's going to lead to even more suffering because people won't have any income? Because the other side of the argument is that if people are not healthy, you can't have an economy anyway because so many people will be dead.
Well, the government promised to give some 600 reais, which is more or less $100,000 for the poor people who cannot work at the moment, particularly the workers with no legal contracts. But there is a problem because these poor people sometimes does not have a bank account, does not have an income tax number, which is the way that's the most used to identify people in the country. So the very poor people have been had difficulties to get this money from the government. And Mr. Bolsonaro argues that this is the main problem, the economy, people who are going to die because of hunger. But this is many people on the other side of the argument say that this is a false dilemma because the economic problems are created by the virus, not by the confinement.
How much is the government involved in helping the healthcare sectors of the individual states? It's very interesting that the president's latest government appointment, his acting health minister, is the 9th man with a military background. That means almost half of the very senior positions in Jair Bolsonaro's government have a military background. He's a man, this acting health minister, Eduardo Pazuello, who's pushing the use of chloroquine as well, that controversial drug to treat COVID-19. How much is the government helping individual states, and how much is it a problem that you have all these people without great political experience directing the government?
Well, last week, the president had a meeting with governors and said that he would sign down the law approved by Congress to give some help to states and municipalities. So this seems to be working. But the problem is that the president sets the wrong example. The former 2 ministers of health who were fired by Bolsonaro adopted these measures of confinement and supported isolation. But this new minister, who is the acting minister, has not been officially nominated, is a general with no experience in public health. And Bolsonaro made him sign this document allowing the use of chloroquine from the beginning of the disease, which is against most of the medical and scientific recommendations. And Mr. Bolsonaro has made something like President Maduro has done in Venezuela, put lots of military in the government to consolidate his power.
Nelson Franco Jobim, we appreciate your time, sir. Thank you so much indeed.